In this video, I'm going to go over trochanteric bursitis of the hip. And that's where you're going to have that pain on the outside of your hip. It can be sensitive just to press on, to touch, difficult to lie on in the bed. You're going to have that pain and sensitivity on the outside of the hip. It can radiate down the leg. It can radiate around to the glute area. And so what that is the bursa sac that's there. It's a fluid-filled sac, and it acts as like a cushion or a spacer between the bone and then all the soft tissue structures that are all around that. And so this is something that can be irritated from either mechanical stress, you've strained it, maybe you were running or you did something too fast, you strained and irritated that area, or this could be from a repetitive strain injury, just repeating the same movements over and over again, you've irritated that. It can also be from lying on it for too long or too much pressure in that area. That can cause some irritation there. It's more common in females ages 40 to 60 years old, so there is a higher prevalence of trochanteric bursitis there in females in that age range. And so one of the things that a lot of times that physicians will do is give you anti-inflammatories. They're going to give you those NSAIDs, Aleve or Advil or Motrin or these different products like that. And then the other thing they can do is needle aspiration. They can go in when that bursa sac really swells up and it's inflamed. They're going to use that the syringe and the needle going to pull that fluid out. Sometimes that resolves the issue. Sometimes that it comes right back and it stays really inflamed and irritated. And in some cases, they have to do what's known as a bursectomy, where they take the bursa sac completely out. They also can cut or trim away a little bit at the iliotibial band there. Sometimes that's required. You have to make sure that you're having true bursitis here. This can be mistaken for hip OA as well as an iliotibial tract syndrome, kind of some stuff going on with that IT band there, as well as you can also have gluteal tendinopathy where the glute tendons come around there. That can kind of show up, and so it can be misdiagnosed sometimes or underdiagnosed just depending on the situation. So you want to make sure that the approach that you're taking or as far as your treatment is accurate in the proper direction. So some general tips that you can do at home right off the bat is try to avoid sleeping on that side as best you can. I know a lot of times we can't control how we sleep, but at least how you start sleeping. If this is my left side that's irritated and affected, try not to get on that left side. Take some pressure off of the bursa sac. The other thing is try not to shift your weight. So again, we're going to say it's my left hip, and a lot of times when people are standing, they'll shift their weight to that side. And so try not to do that, because that IT band that travels over that and the muscles in this area that come down, those can pull and kind of tension down on the bursa sac. So that's going to increase that pressure and compression, so try not to do that. The other thing is sitting with your legs crossed too much. So we're going to say it's my left leg that's affected, right? And so try not to sit with your legs crossed in this position or even bringing your leg across. And there is a stretch that we're going to do with that I'm going to show you. But just, if you're sitting at a desk all day, try not to bring that leg over and just sit in that position just throughout the day. Now let's talk about treatment. What other treatments can you do conservatively where you don't have to have this needle aspiration, bursectomies, etc.? Well, what you can do, one of the biggest things that you do is going to be strengthening exercises of the muscles here on the outside of the hip. Also going to focus on some stretches of the quadricep muscle, hamstring, and the outside muscles here of the hip, what's known as the hip abductors and rotators. And then also you can use a heating pad. The heating pad makes it feel better. And then I'm going to show you, as always, I like to use a tennis ball for a lot of things in musculoskeletal treatment. I'm going to show you how you can use a tennis ball, especially in the glute area, to try to relax some of the tissue a little bit, if nothing else, to modulate some of the pain that you're having in that area. So the first thing we're going to do is work on some stretches. And so one of the stretches that we're going to do is going to be a knee to chest. So you're just going to sit, pull your knee up towards your chest. You're going to feel that stretch on the bottom side of your hamstring there, as well as in the glute muscle. And you're going to hold that for 15 to 30 seconds and then just relax and repeat that for several repetitions. Now we're going to work on a hip rotator stretch and also what's known as a hip abductor. So I'm going to cross, we're going to say my left hip is the side that's painful, it's affected. I'm going to bring it across here, just that in that position. You're going to feel some discomfort there more than likely in the outside of the hip. And then I'm going to take my hands, clasp my fingers together, and I'm pulling my knee to my right shoulder. So I'm pulling my knee across my body. So I really feel that stretch across through here. And I'm going to hold that for 15 to 30 seconds and repeat that several times a day. And then we're going to work on a quadricep stretch or a thigh stretch. Now with this, it's best really if you can do it in standing. You can do this by lying on the mat or the bed. You can just lie on the side, let your thigh kind of drop off and lean back. And as you lean back or you lie flat on your back, you're going to feel a pretty good stretch there. For some people, that's a little too much and it's uncomfortable. So if you can stand, what you're going to do is take your foot, pull it just like this. You're going to feel that stretch on the thigh there and kind of bring it back a little bit and hold that 15 to 30 seconds and repeat that several times a day, just as you would with the other two stretches. Now we're going to perform hip abduction. So what you want to do is straighten out your legs. We're going to say it's my left side that's affected, right? And so I'm going to bring my leg up like this. My whole lower extremity is going to come up. I'm going to bring that up. I'll go, don't have to go super high, just maybe 10, 15 inches or so. And you come out nice and controlled, nice and slow. You're going to feel that on the outside of your hip. And you're going to repeat that for 2 to 3 sets of 10 to 15 repetitions. Now, if you have a leg weight or a cuff weight, you can put that leg weight or cuff weight on just to add some additional resistance. But initially, it's probably going to be too painful. You're not going to be able to do that. If that movement's uncomfortable or you just don't feel like that you can do it or you don't have the strength to do it, I'm going to show you a way that you can do this in standing that works really well. It's known as an isometric contraction. And now we're going to perform that isometric hip abduction exercise. So you're just going to get up next to the wall and you're going to put your foot up next to the wall. You can actually use a towel. You can roll that up if you want, just to put it between your foot and the wall, just to give a little bit of buffer there. And so if the wall was not here, what would happen is my foot would come out to the side just like this. So that's what we're working towards, is that movement. And then I'm going to contract. I'm going to kind of kicking out towards the wall here. I'm holding that. I feel that in the outside of my hip here. I'm going to hold that for 3 to 5 seconds and repeat that for maybe 10 to 15 repetitions for 2 to 3 sets. These are going to be clam exercises or hip external rotation movement. So you're going to take one of these exercise bands. They're pretty inexpensive. I'll put a link in the description for a set of these. And you're going to put your feet together. You get my knees are bent, my hips are bent, just a little bit flexed. And then I'm just going to bring my knee apart from my other knee, keeping my feet together. And I'm going to complete 2 to 3 sets of 10 to 15 repetitions of that. You're going to really feel that on the outside here. If it's too uncomfortable to go very far, you can just go a little bit and then come right back down. Go out a little and come back down, that's fine. But again, you're going to repeat 2 to 3 sets of 10 to 15 repetitions. Next, we're going to work on squats. So with this, you can hold on initially just to stabilize, and then we'll work to more of a free weight or open type squat. So you're just going to kind of hold on here. Put your feet whatever feels comfortable. You're going to work on your hip hinge. Hinge the hips back first, so push back, then bend the knees and come right back up. You can just start with a mini squat initially. You do not have to go deep with this. Just go with a mini squat and then work up towards 2 sets to 3 sets, maybe 10 to 15 repetitions. And then we're going to progress more to doing that with dumbbells or a kettlebell, where you're holding on to dumbbells on both sides and doing that, or you have a kettlebell in the front and you're doing with a kettlebell. Those are fine too. Just don't progress too fast. You do want to load the tissue. You do want to load all your tendons in this area and the muscles, but you don't want to do it too fast, too soon to increase your symptoms where they're not as manageable. Now we're going to take this tennis ball. Again, if you've seen my videos, I'm a fan of using tennis balls for a lot of orthopedic conditions that can be treated in therapy. We're going to take the tennis ball and put it right on the glute back here, right where you're having some of this pain. Now, I know a lot of times you're going to be most sensitive around the outside, but you are going to get some of that referral pain into the glute. And just by putting that tennis ball there and that pressure in that general area should give you some relief with your pain symptoms. So you could do that and maybe use that tennis ball for 3, 5 minutes, maybe 10 minutes. If you're just sitting around watching TV, or if you're in your vehicle, of course not driving, but if you're a passenger, you can just sit on that, hold that pressure, just to try to get some of that hurt so good relaxation of the muscles. Thanks so much for watching this video. I hope that it helps reduce your symptoms that you're having with your trochanteric bursitis. Thanks again.